Welcome to the ANEW Insight Podcast, empowering and inspiring your journey to optimal health. Hosted by Dr. Supatra Tovar, clinical psychologist, registered dietitian, fitness expert, and author of Deprogram Diet Culture. Rethink your relationship with food, heal your mind, and live a diet-free life. I follow my guests' journey to optimal health, providing you with the keys to unlock your own wellness path. Tune in and evolve with us. Hello and welcome to the ANEW Insight Podcast. I am Dr. Supatra Tovar, and I am so excited to have board psychiatrist, author, and Ruthless Compassion podcaster, Dr. Marcia Sirota with us today. Dr. Sirota, so great to see you.
It's great to see you too. And you can call me Marcia.
Okay, Marcia. I love it. I'm going to read a little bit about Marcia for you all, and then we're going to get right into my questions for her. I am so excited to pick her brain. Dr. Marcia Sirota is a board-certified psychiatrist based in Toronto, Canada, with over 25 years of experience in mental health. She specializes in wellness, trauma healing, creativity enhancement, and empowering individuals to become kindness warriors. I love that. As the founder of the Ruthless Compassion Institute, Dr. Sirota promotes empowerment and self-awareness. She is also an author of 5 books, including Be Kind, Not Nice, How to Stop People Pleasing, Build Your Confidence, and Discover Your Authentic Self, and hosts the Ruthless Compassion podcast, which I was on recently, and we are doing a fun pod swap. I'm so excited. In her spare time, she enjoys fiction writing, yoga, spoiling her cats, and working out. Marcia, welcome.
Thank you so much. It's great to be here.
I'm so excited to have you here. We had so much fun on your podcast and really did not want the conversation to end. So we're just bleeding over into my podcast and continuing on, but really delving into you. So I'm so excited to learn more about you. I would love to know what inspired you to go into psychiatry, and how did this journey lead you to create the Ruthless Compassion Institute?
Well, I think I've always been one of those super sensitive people. And when I was young, people would just be able to talk to me very easily. So I became a good listener just because people always wanted to talk to me. I enjoyed listening to people. And something about my personality, I always preferred having more deep, meaningful conversations than superficial chit chat. I haven't been the best at it historically. I've gotten better as I got older, but I always liked having really deep conversations. So it lent itself to this career, listening to people and having deep, meaningful conversations. And I was first a family doctor, and then I noticed that many of my patients were having problems that were not physical. They were more emotional, psychological, addiction related. And so I started doing counseling, and then I started learning more about it. And eventually I went back and did a residency in psychiatry, and I really found my niche. So yeah, it was an evolution, because I hadn't set out to be a psychiatrist, but it suits my personality very much. I have a degree in philosophy from undergrad, and thinking and feeling and talking are things that I like to do. So,
well, how did this formulate into Ruthless Compassion? And give us an idea of what Ruthless Compassion is in your idea. I love this term, but I think some people might be like, what does that even mean?
Well, I've been interested for a long time about suffering and compassion. And as one of those sensitive people, I really am aware of the suffering in the world, and it hurts me to see the suffering. And I want people to suffer less. And obviously, there are things that we can do to suffer less. There are some things that suffering just comes to us because of life, but there are things that we can do to suffer less. And I noticed that there's this concept of compassion that sometimes is misunderstood. Sometimes people think of compassion as tolerating things, as overdoing it, as everybody is good, nobody is bad, everything is fine, this kind of moral relativism. It can be mushy. And I really like the idea of compassion, especially self-compassion. But I thought that our concept of compassion should have a little bit of backbone to it. And so I thought Ruthless Compassion was a very good combo, because the ruthlessness is not about being cruel or harsh. It's about seeing the truth about yourself, other people, and the world with real clarity, really facing what's going on, because so much of our problems in life come from avoidance and denial. So facing the truth is the first thing about the ruthless part. The second thing about the ruthless part is, although we can have self-compassion, that doesn't mean we give ourselves a free pass. It's not leniency. It's not self-indulgence. It's saying, okay, there are some choices I'm making that are not correct, that are not working for myself or for others. What can I do differently? We don't have to beat ourselves up for it. We don't have to make ourselves feel bad, but we can see the truth about some of our choices, some of our behaviors, and go, this is not okay. So it's not a get out of jail free card. And the other piece with other people, compassion is not about just tolerating stuff. It's not saying, well, I'm compassionate, so I have to just put up with it. No, compassion sometimes is setting really good limits and having good boundaries and saying no and giving some pushback, because that can be the most compassionate thing to do for another person, giving consequences, because that's how they get to learn and grow. And so we are an instrument of positive growth and change for them, as opposed to just an enabler of their bad behavior and someone who is teaching them through our passivity that their behavior is acceptable when it's not. So I like the concept of ruthless compassion because it's a much more practical and effective way of being loving, but not a doormat. And that's why I wrote the book, Be Kind, Not Nice, because kindness is about being loving, but not a doormat, not a pushover, and certainly not enabling your own mistakes or giving yourself a free pass. So it's kindness with some backbone, and it's not niceness, which can be people pleasing, enabling, tolerating, overdoing.
I love that. I love that. And I want to get into Be Kind, Not Nice. We're going to get into that a lot more in the second section of this podcast. But I really want to home in on that, because I think a lot of people think boundaries, which is what you're really talking about, are a cold, hard act. And you are really describing it more as a self-compassionate and compassionate act. Go into that a little bit more, because I firmly believe that when we set boundaries, we are being absolutely loving and fully true to ourselves. And we're also being very specific with our loved ones, which provides them a framework and boundaries as far as how they interact with us. And I also think that's a loving, compassionate act.
For sure. So with other people, like, for example, with children, if we don't set limits on their behavior, they go wild, like our pets, right? If we don't set limits, they go wild. All these shows, Nanny 911, Dog Whisperer, Cat Whisperer, it's about the person, the person in the position of authority who needs to have better boundaries and set better limits and have clear expectations and have proper consequences, right? And that's the most loving thing, because our children, our pets, our friends will all feel more safe, securely attached, and have clarity about what's expected of them and of their behavior. And they will have realistic expectations. So if we let our children get away with everything, and then they're going into school and they're completely wild, and the teachers are going, what kind of a little hellion have you raised? We're not doing any favors for them. Or if we let them get away with things as teens, and then they graduate and go to university and they flunk out, or they finish university and then they can't keep a job because they don't know how to respect authority or buckle down and do their work, we're not doing them any favors. So people need to understand, for the purposes of their interactions and their professional life and just their self-esteem and the depth of their relationships, that there are certain expectations, certain responsibilities, and we can be most loving and compassionate to them if we are clear about what's expected and what's not acceptable.
Yes. Why do you think it's so hard, especially for women, to do this? Why are we not great at setting boundaries?
Well, this is historical, but we are socialized to be nice because we've been taught, and I think it's very wrongly and unfairly, that the way we have value is to be pretty and to be nice and to be agreeable.
And quiet.
And quiet. Well, that's agreeable, right? Yes, absolutely. Be nice, cross your legs, don't make a fuss.
Seen, not heard.
Exactly. And I think that's very hateful toward women. I think it's a tremendously misogynistic view. And it also deprives the men of the interesting parts of who women are, not just pretty things that sit there quietly like a picture. Just get a picture then. If you want a human being, you need a personality, you need some interaction. So I think that we have been socialized, and we continue to be socialized to be agreeable and quiet and pretty. We're human beings, and we have opinions, we have feelings, we have needs, we have ideas, we have passions, and we have things that we don't like. And we need to recognize that those are perfectly acceptable. And we're not a bad person for saying no, for saying this doesn't make me feel comfortable. I don't want this. I'm not going to do this. We're not a bad person for asking for what we need, for saying, I need a raise, I need a day off. Like, somebody might push back and say, I don't like it, but we're not bad for expressing our needs and feelings and our limits. And we have to learn that even though the people around us might not like it, it's not a bad thing. And we also might learn that if we're surrounded by people who keep pushing back, maybe we need to choose different people to associate with, people who will be perfectly fine with us having our needs and feelings and limits met.
Yes. And I think you work a lot with clients who have trauma. People pleasing is essentially a trauma response, fawning, trying to make our environment safe by pleasing everyone around us so we don't have the boat rocked and everything becomes chaotic. Speak about that from the lens of a trauma healer.
Sure. So they have expanded the kind of characteristics of trauma to fight, flight, freeze, or fawn. And the fawning part is about both doing too much in order to stay safe, but also doing too much because you feel worthless and you believe that the only way people will love you or accept you or approve of you is by currying favor. There's two problems with that. Well, a few problems. The users will always take advantage of you. The kind people will feel awkward and uncomfortable because you're trying so hard and you're so desperate, and you're also inauthentic because it's not the real you. And the abusers, the bullies, will take advantage and look at you with contempt. So even if you're not being exploited or abused, you're not being authentic, so you can't be loved for yourself. So all that fawning that you're doing, you're putting on this nice act, is not getting you true love because you're not seen for who you are. So the tragedy is you're expending so much energy, but you're not getting any real return on your investment. The best thing to do is just to be yourself, your quirky, imperfect self. There will be people who are capable of loving you if they are capable, and there will be people who aren't capable of loving you, but at least you won't exhaust yourself by putting on this act. You won't get resentful because you're exhausting yourself and you're not getting what you want. And you won't be setting yourself up to be exploited by the users or abused by the bullies. So for people with trauma, they need to learn self-love. And going back to what I was saying with Ruthless Compassion, one of the problems with self-exploration is that if we have a very strong inner critic in our head because we've internalized this negative message from our childhood, if we have trauma or any kind of abuse or neglect, we are afraid to see ourselves clearly because it's generally accompanied by this negativity, like, oh, you're so stupid, you're so bad. But if we can have that compassion, and part of the ruthlessness here is ruthlessly rejecting that negative message because it's not the truth about us, it's just stuff people said to us or implied. And so if we can see the truth about ourselves without self-criticism, then we can heal our trauma, and then we are less inclined to be people pleasers and fawning.
Right. And if you look at any of these trauma responses, fight, flight, freeze, or fawn, they are all born out of a lack of safety.
Yes.
Right. And so it's, I think, easy for somebody to hear this cognitively. Oh, well, you just have to love yourself in order to stop this people pleasing. But I think it's so important to address that feeling of the lack of safety first. How do you help your clients achieve a safer space within themselves so that they are able to assert these boundaries?
That's a wonderful question. And the thing that I want people to understand is that when they were experiencing trauma, they were often young, helpless, unable to really understand exactly what was going on, certainly unable to fight back or assert themselves or set a limit, and not even able to escape. So they were young and really helpless and confused because it was hard for them to understand what was going on and why. I say to them, look, you're not a child anymore. Not only are you not a child, but even when you were young and helpless, you survived this. As bad as it was, you were still strong enough to survive. And whatever you did at the time to survive, it worked for you, but it might not work for you now. The things that you did, like the freezing and the fawning. So as an adult, you have to develop self-trust that you have an inner warrior inside of you that's powerful. And I often give them a visualization to do where they meet their inner warrior. I send them on a journey to encounter their inner warrior. And the inner warrior can be anything. It can be a mythical creature. It can be an animal. It can be a religious figure. It can be a warrior woman. It can be any number of things. But, they often will have a very clear image of this very powerful creature that becomes their internalized warrior inside of their mind. And they can call on that warrior when they're feeling unsafe or anxious or afraid. And so I have them really work with that concept of having an inner warrior so that they can build self-trust. I also work on their inner wisdom so that everyone has an inherent inner wisdom. For women, it's the wise woman within, or the WWW, and for men, it can be something else. But there's an inner wise person within us. So the wise person is our intuition. It's that knowledge that we have, that when we just have a gut sense and it's correct. So learning to trust that gut sense, that inner wise person inside us. So between the inner warrior and the inner wise one, we really have what it takes to feel safer in the world. Look, there's no 100% safety. It's like safer sex. There's no 100%, but there's safer life, right?
Exactly.
So we can be safer and a lot safer. And we can also make choices that are safer. We can use our judgment, our adult judgment, not our impulsivity, that's the child inside us. We can use our adult judgment to do things that are more likely to be safe and less likely to be risky behavior.
Yes.
Not walking through dark alleys at 4 a.m., not hitchhiking on a strange road and getting picked up by some strange random person. We can make choices that are safer, and we can feel safer if we trust our inner wisdom and our inner warrior. And the warrior is not an aggressive part.
I was just going to have you clarify that. It's not somebody who's out there fighting, waging war. It's more like the karate version, where you're working in self-defense, but coming from a place of peace.
It's power. It's really a feeling of, I am a powerful person who has agency and choice, and I can see the truth of a situation and a person that I'm interacting with, and I can know that there is a right action. Sometimes the right action is to get out, is to trust my spidey sense and go, I got to get out of here. This is not safe. And that is not a sign of weakness. That's a sign of being shrewd. That's having a good insight and taking the right action, which is time to leave. It's not putting yourself in physical harm's way or even emotional harm's way. Sometimes the choice is to speak out and to say something. But again, it depends on your situation. You might not want to speak out toward your boss or your supervisor. You have to be more strategic. So you have to really make those choices. But if you have your wisdom and your empowerment with the wise woman or wise person inside and the inner warrior, you can trust that there is a right choice to make in situations, and it's not aggressive. Now, sometimes you might have to be aggressive in terms of being more assertive. Sometimes you might have to physically defend yourself or your loved one, your children especially, but that's more rare. Most of the time, it's just about setting a limit, speaking out when appropriate. And sometimes it's just about saying, I got to go now. I got to hang up the phone, or I got to walk away from this situation because this is not making me feel good and I don't need to expose myself to this. So it's not about violence. It's not about being an angry person. In fact, I find that when you trust yourself to take care of yourself, you're a lot less angry because you have that calm of that self-trust and that trusting your intuition and your inner wisdom. So you don't have to walk around being with your dukes up, being defensive and always on edge, because you really feel that calmness, like, I got this. And you can say to yourself, I got this.
Yes. It's good. How empowering. I love that. I love that messaging. And I think so many people who survived trauma, they tend to feel powerless. And that's why they act out in more negative ways, or why they people please. And if they can really tap into the wise warrior, the wise woman or man inside, they don't need to have all of these extra layers and defense mechanisms and coping mechanisms. They can just reside from their authentic self. I love this. Now, in your extensive background in treating trauma, what do you think are some of the most common misconceptions in trauma recovery?
Well, I've been doing a lot of work with people who've been seriously traumatized, and I see that a lot of times they get labeled as having personality disorders, especially borderline personality disorder, which sometimes they do. But the label can be very pejorative,
Stigmatizing.
stigmatizing. It can feel punitive. And there's a lot of talk right now about something, a different kind of diagnosis called complex PTSD, complex post-traumatic stress disorder, which is much more a trauma-informed diagnosis as opposed to you just have a bad personality, you're a bad person. So they have very similar and overlapping symptoms, and they may be the same thing, in fact. Who knows? Maybe in a few years they'll say, you know what, it's the same diagnosis, or maybe not. But I like to think that a lot of people who have trauma have what's called CPTSD as opposed to just being an annoying person because they lived through this trauma. And so if one of the misperceptions or misconceptions that is that if you've had trauma, you turn into this raving lunatic, maybe what you can say instead is if you've had trauma, it does affect the structure and the function of your brain. It does affect your impulsivity, your judgment, your insight. It does affect your relationships. It has quite a pervasive effect on your life, but it doesn't make you a bad person and it's not your fault. Mm-hmm. And if you can have compassion for these people rather than judgment, and if you can have some tolerance and understanding and some space, they can heal more and they can go through the steps of healing, of facing the truth about what happened to them, grieving their losses, letting it go, and building self-love and self-esteem, then it can be a better outcome for everyone.
No, I agree wholeheartedly. I do see that if you are not looking from a compassionate lens, you can see somebody who's displaying these behaviors and then ascribe them the personality disorder or whatever label you're going to attach to them. But if you can really look at them from that compassionate historical lens and really ask, what are all of the factors that have made this person cope in this way? I think we would be a much more non-judgmental society. I think we would be much more we'd be much more compassionate toward people, especially who have experienced trauma. And you're absolutely right. Borderline personality disorder doesn't come out of a vacuum. It comes from some pretty extensive traumatic experiences that cause a person to develop coping mechanisms that are not necessarily societally friendly. So I love that. And I really am hopeful that CPTSD, I wish that it was a DSM diagnosis because it really does need to be included. When we look at post-traumatic stress disorder, people only ascribe it to that one experience that has created these symptoms. But if somebody's been abused for a very long time, that is a completely more extensive symptom list than what you would see with PTSD. So I am totally in agreement with you on that. Yeah. Now,
let me just add one thing. Nowadays, with my knowledge of this, one of the things I do, if I see someone who seems to have a lot of quote unquote personality traits, dysfunctional personality traits, my first question is, what might have happened to this person? And I want to find out. I want to learn. I want to bring curiosity to it. And what happened to you? How did you end up making these kinds of choices in your life? What happened to you? And if I come from that place of what happened to this person, it changes everything rather than, oh my God, you're so difficult, or, oh my God, how am I going to deal with you? It's okay, what happened to you? And just approaching it that way changes the dynamic completely. And really, instead of making the person into a problem, the problem is what happened to them, not who they are.
Yes, I always encourage my clients to do this as well. If they're dealing with a difficult person and they're taking it personally, I always have them explore, well, what do you think makes a person like this? Because you know that someone who's happy, who is evolved, who has done a lot of work on themselves, they don't tend to act out on other people. It's usually people who have had things done to them and they haven't been able to process it or work through it. They're maybe like perpetuating a cycle. And I think when people do that, it builds their compassion for those people. They can see, oh, this is not personal. This is something that is deeply personal to that person, but really doesn't have a whole lot to do with me. And I think that helps people navigate through working with difficult people a lot easier. So much more to discuss. I can't believe it, but we're out of time for this half of this podcast. And we are really going to delve into being a kindness warrior and discussing your book at length in the next section. So you're going to be coming back, and I hope everyone comes back for the second half of this amazing podcast with board psychiatrist, author, and Ruthless Compassion podcaster, Dr. Marcia Sirota. Join us next time. Thanks, Marcia.
Thank you.
Thanks for tuning into the ANEW Insight Podcast. Please remember, the contents shared on this podcast is for entertainment purposes only and does not constitute medical advice. You can find us anywhere podcasts are streaming, on YouTube at my.anew.insight and at anew-insight.com under the ANEW Insight Podcast tab. And follow us on our socials at my.anew.insight on Facebook, Instagram, TikTok, and Threads for more updates. Tune in next time and evolve with us.